you have negative internal feelings. You don't feel good about yourself, right? Am I right?
I don't trust that.
Of course you don't.
You're the
You don't
government.
trust anything.
You're the government.
Do you have negative parental modeling?
No, you're the government.
No, I'm not the government.
Yes, you are.
No, I'm not.
Yep, doctor.
Maybe it's
Dr.
in your
Government.
genes. Maybe it's just genetic.
No.
A biological factor passed down from your
No,
parents.
Mr. Happy Feet says that you're the government, and I believe Mr.
How about I help you? How about I treat you? Yes, I can treat you.
Okay, you can treat me. What was the treatment?
See, the challenge with treating you is that you don't trust. But I'm going to try psychotherapy. Do you know what that is? You don't?
And I don't trust it because I don't know
I'm
what it
pretty
is.
sure I've gone over it with
was
someone. Maybe that was the antisocial
It was
person.
invented by the government.
It is not invented by the government. They don't invent anything.
Yes, they
You
do.
see, they don't. The government doesn't do
They
anything.
invented Barack
The
Obama.
government
They
doesn't do
definitely
it.
They invented Barack. He's a robot.
Who's that?
He is a.
This
black
is the
robot.
80s. Who's Barack Obama?
He was just created in a lab. I saw him. One day he will be the president, and he will cause the end of the world.
You're crazy. That sounds like a black person.
I'm not
How is that possible?
Because Mr. Happy Feet said it would happen. Okay.
You know, why don't I put you on antidepressants?
Are you attacking
We're-
my character?
No.
Are you working for the government?
No.
Should I trust that?
Yes.
Should I trust you?
Yes. Did you know that 0.5 to 2.5 of the general population have it? Percentage-wise, obviously.
What, did the government tell you that?
Shut up about the government, crazy person. And it's seen in 2 to 10% of psychiatric patients. And it's more common in males.
Are you judging my character?
No.
Is that an attack on my character?
No.
I don't trust that.
Fine.
You're the government.
No, I'm not.
You're the government.
No, the
I'm
government.
leaving. I'm leaving unless I get some sort of treatment. I'm leaving.
We'll give you medication, antidepressants, antipsychotics,
I don't trust medicine. I don't trust. So I'm leaving.
anti-anxiety medication.
We're leaving.
SSRIs or something, I don't know.
Bye, we're leaving.
No, you can't leave.
Bye, we're leaving.
That's not a good idea. The government will get you.
The government is coming after me. By me leaving, they're not gonna get me. Okay?
That's what they want you to
The
do.
government will get us all. All right, doctor. Remember that.
You'll never get help.
Are you the government?
Yes, I am. Is there a doctor inside here?
God damn it! And, you know, he walked away fine. Oh, and there was this borderline personality disorder. Hello, I'm Dr. BPD.
What the hell's that stand for?
Dr. Boris Petersburg Dagovich.
You know they all end in E. I just found that interesting.
Okay, why are you doing that?
Because I like knives, and I like the one you got here. It's pretty nice. It's like it could do some damage.
Do you change between anger, anxiety, and
No, I don't!
and depression?
I don't know. I am very stable.
Do you have extreme feelings of self-destructiveness?
Not recently, but so. What did you do?
Anyway,
What did you do?
do you have a lack of identity?
Who?
You.
Who's me?
You are you.
What?
Do you feel a victim?
You victimizing me right now?
No, I'm questioning if you feel like a victim too.
Is it because I'm white? Or black?
What about Mexican?
There is no Mexican. It's either black and white in my book, my friend.
Jeez, that's another symptom. You see in black and white. Only black and white. There's no middle ground for you.
You're either completely right or completely wrong.
I could be partially right and partially wrong.
No, you really can't be.
I could be.
You're either a really good doctor or you're not a doctor at all.
We'll go with the second choice. Anyway, are you sensitive? Are you sensitive?
Could you stop hitting me, please?
Are you
Could
sensitive?
you stop?
Are you getting upset?
Yeah, I'm getting upset! Oh, fucking stop!
You're sensitive. Do you manipulate people on purpose? Do you manipulate people on purpose?
You should give me your knife.
Give you my knife?
Yes. I mean, you have hardly any desk space as it is. Give me your
I don't
knife
think that's a
will,
good idea.
Giving me your knife will clear some space, and then I'll have two, one for each end.
I don't know if that's a good idea, but okay. I don't think my wife would appreciate that.
You don't have a wife.
Yeah, I'm married. See my ring? Anyway, do you have stressful life events, the history of sex abuse? Have you tried to commit suicide? Do you consider suicide an option?
Who doesn't consider suicide?
Well, one of us here doesn't. And I think that one's me. Are you pretty much insane? Ew. Anyway, forget the symptoms. We already knew you. Quack. Anyway, 20% of psychiatric patients have your disorder.
It's quite a bit.
Yes, it is. And the general population, 1 to 2% of people.
Really?
Yeah, so you're not that strange considering the fact that you are strange. It's more common in young women, so it's like a 3-to-1 ratio, so you're that oddball. But there's 3 women and 1 you.
I have to get with some fellow borderliners. Fellow as in girl borderliners.
I thought fella was a boy.
Can we move on, Doctor?
Okay, fine. Let's look at the causes. Do you have a history of childhood trauma, abuse, or neglect from your parents?
I think everyone in this world has been abused by their parents in some way, shape, or form. Not just a theory, it's a fact.
I don't know if that's true. Maybe some people, not everyone.
Please tell me, Doctor. You're saying you haven't been raped as a child?
No, I haven't.
You're wrong.
Maybe it's in your genetics, passed down from your parents' genes to you, and blah blah blah, you have this disorder that's making you completely nuts.
I don't believe in genetics.
Okay, maybe you'll believe in this, chemical imbalances.
Life and death.
An enhanced amygdala. An enhanced amygdala.
Enhanced? You're saying I'm special?
I'm saying you're a whack job with a hyperactive amygdala.
Alright, Doc, just give me some meds then.
I can't give you meds.
Give me some goddamn meds!
I can't give you meds because meds don't actually work on people like you. It just isn't as effective as...
If you can't give me meds, and if meds don't work,
I can
then
give
what
you
are we going to...
psychotherapy.
And what's that?
I don't want to talk about it. I've already explained it like 3 times. Anyway, what about behavioral cognitive therapy?
I don't like the idea of therapy. I just want some medication.
You can't have medication. I could call the mental health services and they could deal with you.
I'm not being sent to a crazy house because I'm not crazy.
Why are you here then? Because you're crazy. Or we could try dialectin behavioral therapy.
You know what, Doctor? Just stop talking. I think I have the treatment.
You do?
That's right.
What are you doing?